All right, guys, episode 21 is here, and honestly, the energy just keeps on building. Today, we go to Alberta, Canada, where we discuss rural homelessness with an award winning community leader and former deputy mayor. This is the Connect the Dots NYC podcast. And you know what? Fasten your seatbelts because this one's going to be a wild ride. So, without further ado, thank you for joining me today, and let's get started. Marc Boychuk is a homelessness and rural housing advocate, award winning community leader, and former deputy mayor of Peace River, Alberta. His work is grounded in a commitment to bringing together frontline experience, local government, and health systems to address homelessness in communities often overlooked in national conversations. Mark began his journey on the front lines, working in shelters, supportive housing, and outreach programs, where he saw firsthand how homelessness intersects with mental health, trauma, and community safety. In 2020, he's helped establish Peace River's first low barrier emergency shelter, collaborating across health services, housing agencies, law enforcement, and local faith organizations. From 2021 to 2025, Mark served on Peace River's town council and as deputy mayor, championing to homelessness prevention, housing strategy, and mental health informed responses. He continues to serve on regional and provincial advisory councils using data collaboration and lived experience to advance rural homelessness solutions that ensure no one is left behind. Thank you so much for joining me today, Marc Boychuk.
It's an absolute pleasure.
So I've been following your work in Peace River, and what stands out is how deeply it's rooted in frontline experience. How did your early work in shelters and outreach shape the way you think about homelessness today?
Well, frontline work taught me that homelessness is not a single issue. When I first went into it, I thought this is an easy solution. We just got to figure out what the issue is, and away we go. It's an overlapping of many different issues: housing, mental health, trauma, addiction, poverty, and I hate to uh, once we identify it, it's system failures. You know, it made it seem impossible to see homeless as an abstract or theoretical because every policy decision has real human consequences in it. So that's one of the first things I learned about. And it's really what drives a lot of the passion was being able to be right there, seeing the people facing the challenges, hearing their stories, hearing what is failing and what they're dealing with. And a lot of times it's very open and frank conversations about drug addiction, what led to their drug addiction, what led to their homelessness, because you have to find out what is going on our front lines. And not only is it with the people experiencing homelessness, you can get a lot of advice and knowledge from those working on the front lines, which it keeps me close to and builds those relationships. So, you know, um, one of the things I learned about, people experiencing homelessness, how resilient they are, and literally what they have to do to navigate through systems that weren't even designed to help them, and how frustrating that is. So, working there has really helped me not focus on changing my ignorance and my focus from fixing people to fixing systems. So it's really helped and guided me down the right path, I believe, into getting to the core and the root problems of what's causing homelessness, especially in rural Alberta.
And you touched on this a little in your answer, but when you're in policy or governance spaces now, what truths from the front lines do you feel most compelled to bring into the room?
Um, One thing that we got to look at is when we look at the systems is the rules and eligibility for a lot of the people, and they exclude a lot of the people with the highest needs, which is so there's so many big gaps that people fall through, and then we're responding to that, which is very expensive. It's very expensive the way we respond to homelessness. So what I like to bring in is prevention and stability are far more cheaper, and it's way more humane because you're not waiting for people to get into crisis before you help them. You're helping them way before that, right? So, and one thing you have to bring into the policy is we have to point out where our systems fail, and realize that the systems are failing, and it's not so much the people failing, but it's the system. And building these relationships on the ground, it really matters. So it's an important part, but one that not a lot of people focus on because it's boring, it's behind the scenes, it's very slow sometimes, especially when you're working with health agencies and governance. It's a slow moving process, but it needs to be done, yeah, or else it just nothing changes. It just keeps staying the way it is.
And how did working directly with people experiencing homelessness influence the kind of leader you became in local government?
Well, one of the first things I did was do an awareness campaign to myself find out firsthand what it was like experiencing homelessness in rural Alberta. So I ended up sleeping on the streets for 2 nights in January when it was quite cold. And to be sharing a space in a public space like a post office for people trying to survive through minus 40 plus temperatures at night, it just made me realize that this is a complex, very complex problem. And prior to that, many in our community didn't think that these people, they chose to stay out there. So it kind of helped me become a translator between what's really going on the streets to the council rooms where, you know, I can speak for those that don't really have a voice. They don't have an opportunity to get into a decision making room, and I've been very fortunate because of my connections and the relationships. I've been able to be in some of these rooms and help change policy, on how we fund things and do things differently. So it's all about collaborating and getting the right information, over just trying to control a system.
And obviously, one thing that you mentioned are that, unfortunately, the majority of these people don't have the ability to get into that room, to get into that sort of place of bureaucracy where we can make a real impact. And this is probably heightened when it comes to rural homelessness versus just homelessness generally. And so, at least from what I've seen, is that rural homelessness specifically is often missing from national conversations. And so, what does homelessness actually look like in places like Peace River, and why does it often go unseen?
Um, we have a small population. Like you'll probably laugh when I say I'm in a bigger center, but we only have 7,000 people, and our whole service area is maybe 10 to 20,000 people. Within a hundred mile radius there, kind of. So, our biggest city is about 2.5 hours away, and that has about 50,000 to 60,000 people. So, we're pretty isolated, and you know even though homelessness has been around a long time, I don't think we've seen the magnitude that we've had here lately. And so there's not a lot of services out in small communities because it really has not been a big issue. So there's a lot of people that are when it comes to rural homelessness, it's very hidden. You will not see if you see it on the streets, for every person you see on the street, there's probably 10 that are experiencing homelessness that are not on the street, right? And people bounce around between different communities because we have um, wildfires that move people from community to community up here, and we get people moved into hospitals because our hospital serves a massive region, and we also have a correctional center that serves the whole province. So we have people being released from the correctional center that have no mode of transportation to get maybe 1,000 kilometers south down home, or means to do that. And so we have overcrowded housing. We have reserve issues, people living in their vehicles. I often run into people at campgrounds, and it doesn't take you long to figure out when somebody's been living out of their vehicle. And of course, we have encampments, which cause a lot of problems, and different reasons in your community. So, there's it looks a lot different when you have zero places to turn to, and that was why it was important for us to open up a shelter, up there. But you're often running into people and saying, do you know we have a soup kitchen? No, I didn't. So you can send them to the small little services that we do have, but more often when people are homelessness, they need a little more help than a bowl of soup.
And what are some of the biggest misconceptions that you feel exist in modern day media about rural and northern homelessness that you encounter?
um the biggest one was that it's rare, or doesn't exist. In 2022, our province, uh, rural Alberta, had just under 30% of our province's population, and we received 1.68% of the funding to combat homelessness in the province. So it went to 7 major cities, and it was just thought of as that time. Maybe there's one or two people in the small towns, but every major city, let's focus on that, and we can solve homelessness, right? And so even many people in my own community, whether it was RCMP or addictions counselors, they often believe that these people had homes, and once you looked into it, there's reasons why either they were kicked out of these homes or not allowed or did not return to them because it wasn't safe. There's It's a lot more complex to say that why people are don't have homes. So we started looking into that, and we looked. One of the main things that changed my direction was that substance. I used to think that substance use was the cause of a lot of homelessness, and instead it's rather I've found out that it's a coping mechanism for a lot of people, and so they usually have underlying uh, issues underneath, mental health issues that are turning them to drugs and alcohol for comfort, right? So if we can't just deal with the substance use. We have to have some longer term care for some people, and then one thing that is rural communities, we don't have the capacity to respond, and so it's a challenge. A lot of people don't want to take that on because it's too big, but once we identified it, then it's a lot easier to start tackling it. And that was what I believe is one of the most important things, is to actually find out through a credible source what is actually the reality of your community.
Yeah, and kind of putting together what you've said in the past couple of answers, prevention is definitely something very important, whether it's, preventing people from having to rely on alcohol or drugs as a sort of coping mechanism and just sort of stopping homelessness before it gets to a point where it's hard for, smaller towns such as Peace River to deal with it. And so I want to ask you, what do you think are some plausible and or successful prevention metrics or methods that could work in Peace River, but also other rural communities around America?
Well, some of the great things that our province is doing right now is look at foster care, for example. Is many children were aging out of foster care at the age of 18. And so through some indigenous groups and agencies, they've extended that assistance to age 24, which under the definition and the national definition of homelessness, youth homelessness is up to age 24. So, it kind of aligns with that and allows people to get, when you think about it, I won't go too far into this because it's quite a complex system, but when you think about the foster care system in itself, um, and here's a great prevention thing. If a child has been in 3 or more foster care homes, there's a 97% chance they will be incarcerated as an adult. So if you can head that off with more supports, proper training, family counseling, all these things that, and I'm not a counselor, so I don't know what are all these of the experiences that are causing these, but when you have a stat like that, you can spend some time, and we know in youth homelessness, for every dollar spent, you're saving $20 in the health and court systems. So it just goes to show that, we spend a few dollars. Eviction prevention programs. They ran a program in Toronto where they saved 97% of the evictions, and it was all over $4,000 or less. So like your people are losing their homes and their possessions. So, um, these are a lot of things that housing agencies struggle with, is they put strict rules in place and then they kick people out. And it's really not serving anybody, instead of, but it's, so we look at these kind of policies there. They go a long ways at preventing homelessness. 75% of the people that use an emergency shelter, they never go back. So, if we can prevent a lot of people from showing up there, then we can deal with the more complex and expensive cases, right? So, but right now we're just responding so much, and it's so overwhelming, and nobody's really doing it in a coordinated approach and working together, especially in small rural communities where you literally have to fight people saying, we don't want a shelter here because you're just going to attract a bunch of homelessness and crime. And so, and you got to deal with those kind of things when you're really struggling to prevent people from burdening the medical system and the police services and stuff.
And what are some large scale policy changes that you would like to you would like to see be made such that the sort of, complex and heavy issue of homelessness can be sort of limited and made easier on rural communities?
Um, well, we formed a task force in Peace River just past 2020, and one of the things we attacked was a policy about that funding in rural Alberta, and so we ended up doing what's called a resolution where we take it for all the resting municipalities in Alberta, and we ask them for their the support to change the way the government funds homelessness. And we presented it in a case that a lot of rural homelessness is being driven into the city, which is overwhelming their systems, which is making it difficult for everybody involved. And so these resolutions get voted on by the rest of the municipalities, and we ended up getting 96% of the municipalities of Alberta support to change how we fund rural homelessness. And so that never would have been done if we didn't stand up as a group like that. And so we advocate things like that. We're trying to advocate for how our police respond to mental health calls and advocate for specialized police units that are trained with mental health nurses and stuff like that. So we've advocated for that. Peace River had one of the highest success rates with their team going, and the city of Edmonton, they're having great success. So we're seeing more and more of that different type of police response, because it's been a complex problem for our police responders, and how to safely deal with a lot of people they experience in the midst of a drug-induced psychosis or just a bad day, right? So those are the kind of policies that we're trying to change. It's you might not see it for 5 years. We're trying to change how hospital admittance works for people in a mental health crisis, and supports for people that need mental health crisis, whether it's a traumatic car accident, um, an abuse situation or something like that. We had these problems off right away because we have the data to prove that the sooner we deal with traumatic experiences in life, the better off that person is, and our healthcare system.
And how does, geography, which is, one of the sort of issues or facts that you had mentioned, combined with the sort of limited services and social visibility, shape the experience of both homelessness, but also the solutions that are available?
Um, we are so far away from services, and one of the main policies that I wanted to attack was the transportation of people formed under our Mental Health Care Act. So we have a process where a doctor can or a judge can form somebody under our Mental Health Act, and that means that they immediately need to be transported to the nearest designated facility. So for Peace River, that means it's a 5 to 6 hour round trip to the closest one for our RCMP officers, sometimes 10 to 12, and sometimes as long as a 16-hour return trip. And these are just transporting people to a facility where often they just get put on a 72-hour hold and then they're released again. So it was not working, and you can see the manpower, the time, the cost, the doctors, all in two different hospitals, you know, and so then the hospital ends up being a place where people can't go to for help. It was the only place people could go to help, but the solution was to transport them out of community. It didn't work for a lot of people, right? They were stranded there, right? So, you know, um, we had to look at how what we could do in our community and be realistic about it, knowing that we're 5 hours away from a major center where every doctor is that you can, and when I started looking into the data for a child in Peace River in crisis, it was an average of 67 days before they seen a doctor, whereas in the city it was 7. So you can see the disparity. And then you've got parents dealing with a child in crisis, having to make arrangements to travel in the winter, and harsh roads, long distances, and find accommodations and have the expense to stay in a city for a couple of days just to see a doctor for 45 minutes. So we had to make sure that we had flexible. We started getting some video conferencing in, locally tailored, and we can't just import something that's working well in the city and say, okay, let's implement this in Peace River. We or in rural communities, and that's where I think we're starting to fall behind. Is just we need to map out what services we do have and get people to them, and it is a big problem in our province for people to find the pathway to get the care. That's one of the biggest gaps, and that's why so many people remain in the cycle of homelessness, and they'll just stay at a shelter versus move to another. They may have to move to another community to get housing, right? And they're away from their family, their doctors, their support workers. That's the only people that have been helping them, and the solution is to move them away. So geography is important, but it's things cost a lot more. It's a lot more to retain staff. You know, there's a lot of challenges, but we have to address them, identify them, and work at them.
And one thing you did is that you played a key role in building Peace River's first low barrier emergency shelter. So, what made that model necessary in a rural context, and how did it work?
So once again, speaking that we're a small rural community, we have a domestic violence shelter that serves into our next province and the province and territories above us, right? So it serves a massive range of people, but it is what's called a dry shelter. So that means no drugs or alcohol or people using drugs or alcohol are allowed to stay there because there's families there. And it's a pretty strict policy. And and so what they started to see as time went on, especially you know um it was the domestic cases rising, but people were showing up with the substance abuse problem. And so they found that they couldn't accept these people, and so they were left to turn back to go back to their abusers or to try and live on the streets themselves. So we you know uh, the shelter was deeply driven by the women's shelter for this need for a safe place for women to sleep at night, right? And the first year that it was open, we transported many women, and that was only one of the only places that was allowed to late night access was connection through the shelter of the RCMP. So you know so you know a lot of traditional shelters, they exclude people with complex needs like that, and so there's now a lot of people with nowhere else to go. So there was no alternatives. People were sleeping in ATM machines, they were sleeping in the post office. But what happened there was there's a lot of violence that was going on to those sleeping in the rough. And so, and 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 it wasn't good for bank owners to be coming in and people sleeping on their floor and having slept there through the night, and there's a garbage and mess. So it just wasn't working. And then what a lot of people don't really look at is how much our ambulance services are used through the night when people are freezing or stressing out or having, and policing. And so by opening a low barrier shelter, it filtered and headed off a lot of these issues. It saved a lot of ambulance calls. We now had a street team that with nurses can go in there and work on do minor first aid and light counseling. And it's also the place where addiction services were offered. So we now allowed a door for people to enter in to get help, but now we're faced with the problem of getting the services that they need to get help. Right. So we knew we had people with issues. We now are keeping them alive through the night, especially in the winter time, because it's in a winter emergency shelter. But we're still finding there's a high need for services for those that are there.
And while building the low barrier emergency shelter, you must have had to bring together, frontline workers, health systems. You mentioned there were, nursing teams as well, and surely other community organizations as well. What allowed that collaboration to work?
Well, oddly enough, it was a small collaboration, and it was driven mostly by our Alberta Health Services and a very compassionate worker there. She was being encouraged, or I'm not sure if she was actually enforcing an encampment that needed to be closed down. And she's like, I just can't stand the fact of putting these people out on the street, especially since it's now getting below zero, right? And so we got a small committee together. She reached out to me and another gentleman who did a lot of work in our community, who's a wonderful soul. We got the RCMP involved. We got the women's shelter, and then we got the friendship center. And we had one meeting, and it's a miracle. We ended up getting 42 volunteers that put in over 4,000 volunteer hours to operate a 7-day a week shelter, strictly with volunteers for through the winter months and even through COVID, which was kind of scary at the time, because people with no place to live, and to have volunteers coming showing up with people that are in contact with a lot of, it just showed the care and compassion of our community. And shortly after that, we had doctors pitching in and donating funds. We had community members pitching in and donating funds, and corporations donating funds, and then we got funding from our government, and the shelter's been open ever since. So, these small collaborations can go a long ways. And we, we're dealing with issues now, but we're going to work through them because it's a vital service to our community.
Wow, yeah, and I commend both you and those volunteers. I mean, that's crazy. Like 4,000 hours, 42 volunteers, 7 days a week is no easy feat by any metric. And using that collaboration to create even large scale change and building up from a small system to policy change is absolutely incredible. You also worked and helped lead your region's participation in the Rural Homelessness Estimation Project, which was slightly more data focused. Why was having real data such a turning point for Peace River?
It was not only a turning point for Peace River, it was a turning point for me. And like, I'm not a trained social worker. I'm just, I worked for in a manufacturing plant for 35 years. I don't come from a background of this, but I accidentally stumbled into it like you did there. And, once I started uh, talking to people about it, is like, we don't have any homeless people in Peace River. Everybody has a home. And I'm like, well, why is there 5, 6 people a night sleeping in ATMs? Why are women choosing to sleep under a plastic tarp versus go home? And from my viewpoint, but getting back to when I just thought it was a substance use issue. So I literally thought, I'm going to collect data that everybody experiencing homelessness here is just needs a detox, and we're going to be able to get the justification for it and get it fixed in. But so, and this was an interesting way that we collected data. So in major cities, they do what's called a point in time count. You may have heard of it, where they just get volunteers and everybody covers a massive area in one shot. And so we tried that in a rural community, and they put in 700 man hours into this. They found 2 homeless people. And so when we did this the rural estimation project, in the same community, they found 40. And so what this did was it took a survey to the service providers. And so for example, in Peace River, I would take the survey to the soup kitchen. And then when 15, 20 people showed up to do it, I'd ask them if they'd like to do the survey, and then if I ran people at the food bank, and I took it to this outreach schools, and we took it to any organization that people would be seeking help, Alberta, and so it goes over a 2-week period. And I believe we collected probably 100 and some surveys, and it's goes through a very credible database and stuff like that. And we ended up in Peace River finding out we had 43 people experiencing homelessness under the definition, and we had 9 youth. Whereas everybody. So and for me, it said, one of the questions asked was, you know, um, what's one of the main reasons you think you're experiencing homelessness? And by far and above, mental health challenges was at the top of the list. So it made me realize that we need mental health services, not addiction services, and look into addiction a little bit more. So, it moved the conversation from if we're going to do anything to what are we now going to do? So it allowed Peace River to be seen, and we got funded from being seen. And now, we're part of the broadest homeless picture in our province. So having that credible data is vital from a credible organization.
And just to, give the audience a picture, I mean, obviously 2 to 43, I mean, that's an insane jump. But I mean, as well, 43 unhoused individuals within a smaller community. I mean, obviously I'm in Manhattan where we can comfortably boast a population of around 5 million. Um, but still the I mean sheer scale of 43 and 7,000. I mean in Manhattan we have around 100K, like that's actually fairly proportional once when someone thinks about it. And so just understanding the fact that like having 43 unhoused and out of those having 9 who are youth, and out of all of that having only previously found 2 with the point in time calculations is absolutely insane to me that we what was missed was almost a sort of 20x sort of amount of people. And with all this data, you can obviously count how many unhoused individuals are in a community. I mean, we've seen that in obviously Peace River, but in cities around the world. But can you use it to change how communities understand, responsibility and response in terms of where to structure and where to place certain services such that they can, help the most amount of people based off of where the unhoused community is more prevalent?
Well, to me, data is vital. You know, it just goes to it literally exposes our system pressures. So when we know how much an ambulance call costs, how much an emergency room visit, how much a hospital bed, a jail bed, those are all astronomical costs when supportive housing is peanuts compared to that. And you're allowing our officers. We have weeks in Peace River, and this is one of the main datas that, I was in a seminar and on community policing, and one of the questions I took out of that was to ask our detachment commanders, how much of your calls in a typical week are non-crime related? And at this point, we were above 65%. 65% of their calls were mental health calls, backing up, and so this does not allow our police force to be effective in dealing with drugs and crime and all the other things that they're supposed to be after: speeding, drunk drivers. We kind of joked in our community is like, when's the last time we seen a check stop? They just don't have the time anymore to set up 4 or 5 guys on a street and work a couple hours. We've now had weeks where 100% of the calls were non-crime related. So when you start to look at data like this, it's like, how in the world do you fight crime? And sometimes it's the same person 3 to 4 times a day, and holding 8-hour hold doesn't work. So, it exposes what struggles our healthcare are having, or our justice system is having with, people coming back 5, 6 times for crimes. And it definitely exposes the pressure on our housing and what's going on there. So, it shifts now for me, especially once I became a community leader. It's a community responsibility. We're all responsible for the safety of our community, and so we can't just look at, oh, it's hurting downtown businesses. Well, yes, it's hurting downtown businesses. It's hurting our healthcare system. It's hurting our ambulance response. It's tying up police and causing overtime. It's increasing taxes. It's decreasing the health and safety of the community, right? So, when we get that data, it gives us the leverage, in which we've got some incredible leverage, especially around prisoner releases, that gave us resources. It gave us hundreds of thousands of dollars of funding to deal with how we deal with our correctional center releases now, right? And we're looking at policy change. And so, it's driving change, but until you have credible data and people willing to work at solving these issues, it changes the whole way the community should look at things. It gets your business people involved, it gets your church leaders and other community leaders involved. And that's how I believe the only way we can end homelessness is by getting the whole community involved. It can't just be the mayor and council's responsibility. It can't be the provincial or the MLA, the MP. We all own this problem and issue. And so we all work together. We help out people in need, and watch what happens to your community when you do that. You know, it's a wonderful thing.
And how do we make, the data that you recently stated and that we know exists more prevalent? Because one of the issues, at least I've heard from, previous people that I've interviewed, I was lucky enough to interview Dr. Samson Barris, who, sort of created the housing first, uh, idea and method that's, proven success. But even though there's data, the sort of narrative isn't there. And something that I've seen a lot is that, we are getting beat out on the narrative. And so I wanted to ask you, how did you go about, changing the narrative to focus on data and really spread that data to show that this is a real issue that needs to be fixed?
Well, one of the first things I did is I realized when I was working alone that wasn't working very well, and your credibility only goes so far, right? As wonderful as the information you have. So what I did is I formed a task force team, and it wasn't just for the immediate community; it was for the whole entire region. Because I believe, because we're small and rural, this wouldn't happen in a larger center, but we need it all to work together. And so one of the key reasons why our resolution was successful is because this was benefiting 5 different communities, all working together to solve one issue in their area, right? And so by collaborating that way and working as a region, and then now slowly we've taken in the women's shelters. We've got the RCMP, we've got top government officials in the healthcare system, and we're trying to include our business community, and soon we'll probably get the church community in there, and how can we work as and this is what I believe should be eventually passed off to every council, is they have a, whatever you want to call it, a poverty reduction team, but just all working together, because so many of our municipal people, and it's just like our police, the job of municipal people has been parks, roads, getting the snow cleared, getting the ice surfaces made, you know, h- h- promote businesses, promote your community. But now it's like, since when do we have to solve crime? Since when do we have to stop these fires and buildings that are abandoned, and these are all costing taxpayers a lot of money to respond to. So I believe that the municipal government really has a role here, and they don't have to solve the problems with taxpayer dollars, but they can definitely use the resources they have in their community to make things a lot easier and to advocate.
And where do you think municipalities underestimate their ability to lead on homelessness solutions?
Well, politics, that's another fun learning curve I had, and I highly recommend it. It is amazing what people on council actually learn, and what you actually deal with that you never thought you would. And it's a massive responsibility. I don't believe municipalities should be the leaders. I think they should be the leaders in their localized issues and advocating for their health centers, advocating for their shelters. You know, um, they can lead the coordination in a lot of this. They've got administration and staff. So, like I say, they can chair the meeting, but they don't have to do everything in the meeting. They can guide other agencies and stuff like that. And we need to get, even, what does this look like? Who are we getting to the table? And then when you think about all the people you need at the table, that's a massive table. You've got to get housing, health, justice, social services, frontline responders, lived experience. So it's not a easy fix, but the municipal leaders they're the closest ear to their community that anybody will have. And so they need to take that voice back with them when they meet with the provincial and federal governments, and they need to just work at resolutions in their own community. So it's a little harder to get them to begging for funds and getting them in shelters than it is to cutting a ribbon at a new business and eating cake. and donuts, right? And and so we've got a little bit of a change to do, and a lot of work to do.
And you've worked at the intersection of local government and health systems. So, how should responsibility for homelessness be shared when mental health and trauma are so central?
Well, and that's why I put our task force team together. So we now have our hospital. We've switched it now. It's called Recovery Alberta. It's a branch out of our hospital for mental health and addictions, working with our RCMP in our community very closely. This is a rare thing. We have other detachments calling us saying, "How did you get this to work?" So we've got our hospital and RCMP. We've got our shelter working in that group as well. And now we have two shelters. So we're going to just build, we're going to all share this stuff. We have to be partners in this. We just can't be downstream responders. We can't leave the EMTs to battle it out. We can't leave the police to battle it out on their own, So we just all need to share those responsibilities together. And like it's I don't know if it's unheard of or not, but we as a municipality have been advocating for our RCMP, which generally I don't know if there's other outside agents that or our health services. Usually these are all internal things that they got to plead their case on. And now you've got outside agencies with credibility that are meeting high level RCMP officials and stuff through, becoming mayors and councillors. You get these opportunities. So it's have some open conversations and difficult ones. And the most important thing is it's not the failure of the RCMP or the health system or our government. It's a failure of the systems we have that were not really designed to meet the needs of the people that do have. So let's have some tough conversations and fix this. It's not that hard, actually.
And I always like to sort of conclude these podcasts by asking a couple questions about the sort of road forward. What can we see with the next upcoming generation? What are some of your ideas if you could have anything, sort of happen in terms of homelessness? And so the first one is, what gives you hope right now about the future of rural homelessness?
Well, you know, the fact that we've identified it and that there's a need, that was a big battle. It was a very big battle to show our government, both federally and provincially, that small rural communities are struggling hard, and it's costing everybody. It's costing businesses. It's costing, all services, right? So, um, now that we're identified these issues, they've come to the front. We're starting to work at them. New roadblocks have come up, but we're moving forward. More people are becoming educated. The stigma around mental health and addiction is being dropped. More recovery beds are being built. More focus is on housing. So it's still lots of work in the policy and our systems, but we're moving forward. It's I have to say it's downright depressing some days. Like there's literally I could go out on when I'm in Edmonton, I could go out on the main street there and there's literally people dying every day. Ambulances going up and down the streets. It's very hard to see people suffering. I talk to people who are giving up hope because they've been trying to get housing for so long. There's people out there with disabilities. I just don't know how they do it. I honestly don't know how they do it. You know, um, but I lose hope a lot of times. But it fuels my when I go on and run into these people out there, and I hear their stories and share tears with them. It really motivates me to get at it because it can't quit. We can't, you know. And every day we wait, it's just getting worse. But I do have hope that things are changing, and I've attended some conferences that we've come a long ways in the 8 short years I've been involved in homelessness here. We've come a long ways, and so if we keep increasing at this rate, I have hope that I know there's been 10-year plans written here that expired almost 10 years ago, how they were going to end homelessness. But we got to realize how complex it is, and And where now people like myself have pointed out how expensive it is. There's being money spent in prevention, and so it just takes time to turn this big ship around. You know,
And for listeners inspired by your work, what is the most meaningful first step they can take to build collaboration and create change in their own communities, especially the ones that are often overlooked?
um, well, eventually one day I'd like to get into this where I do this full time, where I go to communities and help them out. And the first meaningful first step is to listen to what's going on your front line. So go to an I spent a lot of time in emergency rooms. I went into our correctional centers. I went into the shelters. I went into people's homes that were living in income supported homes. You know, that is what's guided me to change a lot of policies, which I had zero idea that a simple eviction program, you know, um, preventive maintenance programs in homes, helping people fix up homes that they're in, before water leaks into the roof and all these things, right? And you know, getting data, getting stories together, and often the thing is don't wait for permission. Local leadership is what matters. Like as much as I'd love to go to every community and tell them you need to do this, I know as soon as I leave the they need somebody local. They need that local leadership. Without it, it's not going to be sustainable. So, you know, I one of the key things I think is identify these local leaders. It might not be the mayor or the councilors. It might be a community leader that's been there for 50 years doing wonderful things that so many people look up to. You'd be surprised at who comes out of the woodwork, right? So, you know, just uh just find out what's going on and try to get an accurate picture. But there's a lot of people you have to get the whole picture, and so I would encourage a lot of municipal leaders to talk to their police departments, talk to their emergency services, their firemen, see what's going on, especially around homelessness and drug addiction.
Well, prevention, storytelling, and data, those are definitely the key themes from this discussion that we need to stop homelessness before it happens. We need to learn what's happening. We need to have data to support it and then really put our efforts into preventative measures rather than trying to stop something that is already happening and stop it after the crisis. Thank you so much, Mark, for joining me today. I've really appreciated your time and for you sharing your experience and your knowledge.
It's my pleasure, Vinant, and I have to say you've inspired me. So I'm coming away happy as can be having met you. You're an inspiring young man, and I look forward to watching your journey and the change that you make, whatever field you're in.
Thank you. Thank you so much.